Yeah, before I jump in, again, thank you for doing this. I know you personally and through our work together, you do things and see things a little bit differently in terms of much more structure and
Mhm.
you're very successful at that business part of this work. So yeah, so for our talk today, I don't want it to take more than about an hour.
Mhm.
Uh, and I have a little list of questions that I
Mm.
can kind of go down. But I guess I'll just yeah, just kind of kick it off with
Sure.
having you yeah, describe what it is that you do and how long you've been doing it.
Sure. Well, the label I use, because that's kind of a tricky thing when it comes to these um, professions. Given that my experience is that every practitioner develops their own set of tools, no matter what label they have on them, right? So, but I'm a neuromuscular therapist, is what I call myself, because I think the best term. Like if you looked it up on Wikipedia, then it describes better what I do than anything else I could label myself as. And what that translates to is that I'm an expert in how soft tissue behaves. Right? When to determine whether it's healthy and functional or not, and finding pathways in the nervous system to reset things that aren't working correctly. And that so the tools that I have in my toolbox, so to speak, would be trigger point therapy. That was the first thing I studied. Rolfing, which is another soft tissue technique. Um, there's neurodermomodulation, which is something I learned fairly recently that has to do with releasing peripheral nerves to reduce stress in the central nervous system. Neurokinetic therapy, which is a nervous system reprogramming technique, and actually, I actually studied the neurokinetic. Yeah, it's the NKT most, but I also study with a couple other people that have different methods, like the Nemrov method is under the same umbrella. And then recently, because of my focus on chronic pain and chronic, difficult injuries to heal, I have done a deep dive in the last 7 years into the modern neuroscience, using primarily the polyvagal theory as my go-to lens to help people's nervous systems regulate. Because what I discovered, both in my own health and my clients that were chronically ill, like chronic pain and other things, is that nervous system dysregulation is probably the number one cause of perpetuating pain and illness in everybody. I mean, so when I discovered that, and I used it on myself first, had spectacular results. And it's a whole nother story. My whole background of trauma and dysregulation was pretty extensive. So it was no small thing for me to discover something that actually worked long term, because I had not found that previously. And so I put that all together. And so what I do now is I help people with regular injuries and pains, but also chronic pain. And I use that neuroscience as a guide. And I do have therapies that have to do with sound and movement that help
Mhm.
rewire those systems. And those two things do not fall under the umbrella of typical neuromuscular therapist work.
And that's the sound and movement,
Mhm.
the
So
nervous system regulation, polyvagal.
exactly.
Yeah.
So that's a pretty good summary of my offerings, as they say.
Can I ask you, so going back a second to chronic pain versus, so originally, as you went down the list, trigger point therapy, Rolfing, I think those are things that someone might come in with a specific pain, like specifically my left arm hurts and, I don't know why. And we kind of look for the source of that particular spot.
Exactly.
But then going into chronic pain where it's more widespread, and I think that kind of fits into the nervous system dysregulation.
That's right.
Uh, can you kind of talk a little bit about how um, you might decide, like with a new client, if which way they need to go, or and are you just kind of blending each in a session as a session goes through with a
That's an
client?
excellent question. So, yeah, I mean, the chronic pain is really typically defined medically as pain that is persistent after 3 to 6 months. I mean, it depends on who you read, but um, and the fundamental difference is that when you have chronic pain, let me put it this way. This is how I describe it to clients. Let's say you're walking down the street and you trip over something and you fall and catch yourself in a weird way with your shoulder. And your shoulder doesn't work right after that. It's kind of frozen up or hurts when you try to raise it up. So the question that if they come to me after that happens is, okay, what's the problem now? So did they break something? Because if something's torn, they may need to go to an orthopedist. Like, if they, but if they just strain something or pulled a muscle, then that's where I really shine. However, if that pain persists beyond like 3 months, now by 3 months, soft tissue is going to heal already, typically, unless it's a ligament or cartilage or something like that. And if the pain persists, it's actually central nervous system problem. So it's an interpretive problem. So it's what happens is that the nervous system gets into these habit loops, just like all of us do generally. I mean, it's no different than I eat too much sugar and I don't want to, but every time I get near sugar, I do it anyway. Well, with chronic pain, what it is there's this loop of pain report, and it's stuck in the central nervous system. It has nothing to do with the original injury anymore. And to solve that, you need to break that habit. Now, how you do that is the magic question. And there's different neural pathways that you can stimulate, and you got to figure out which neural pathway is compromised. And if you stimulate that one correctly, then you have a change of symptoms, right? You have this disruption of that pain cycle. And it's tricky because everybody's different. Their nervous system, their biology, even the same people from the same family. So if you want to, you can't just take someone in the office and say, you have chronic pain. I know exactly what you need. I'm going to give you this protocol that I give everybody. That doesn't work. I was really hoping that's what I would find, by the way. That's kind of
Mhm.
what we all hope. You're like, oh, I'm going to find the way. And what I've discovered is the way is actually being incredibly open-minded and curious and realizing that no matter how much I know, someone's going to come in, tomorrow and stump me
Mhm.
because that's the way it goes. And if you follow any of the experts on chronic pain and PTSD, like Dr. Vanderkirk, that's what he says. He goes, you want to have as many tools in your toolbox as you can because it's just not clear what people need when they walk in the door. You have to be explorative with it. So it's a challenging thing to take on, especially because people are upset because they've been hurting for like,
Mhm.
months or years. It's interfering with their life. They've already been to 28 people. And so they're hoping this will help them this time.
Yeah.
But if when you succeed, it's unbelievably satisfying because someone's life is altered for the better. You had something to do with it. It's like it's pretty cool, but it is hard, and there's a lot of challenges involved.
Yeah. And I like that, that you bring in the fact that, people are upset.
Yeah.
And so that's a piece of your work, that emotional aspect, that connection, and like really,
Hmm.
again, understanding the nervous system and the brain and how those emotions can perpetuate some of the pain and trauma.
Yeah, and it's kind of part and parcel as well. So I mean, without going too deep into this, because I could go on for hours, but about why this works, and how it works, is that whatever. So let me back up a second. Fundamentally, there is no difference between chronic pain and trauma.
Right.
And the reason for that is because what you have is you have a nervous system that is chronically interpreting its environment as dangerous in some way. And it's not true. So this is, have a misinterpretive cycle going on. Because one of the things I discovered in my deep dive into neuroscience, it was quite surprising, is that pain is subjective. Pain report. It's highly subjective, and people would argue, well, wait a minute here. What do you mean? When I hit my thumb with a hammer, it hurts every time I hit it. Okay, that's true, and that's real. But what if you hit your finger, your thumb with a hammer, and it hurt for 6 months, and the X-rays showed no damage, and the MRI showed nothing, and all the medical tests showed nothing? Well, that's a misinterpretive cycle. But also just general stimulation interpretation is incredibly variant depending on how the nervous system is. So
Mhm.
some people are very sensitive to sound, touch, lights. This is actually a sign of nervous system dysregulation. But it's also, some people are, I'm a sensitive person. So my threshold is different than someone else. Like there's some people that can, like some of these soldiers that are really good soldiers, they can go through battles, explosions, death, and it's not like they like it, but they
Mhm.
can shake it off. Someone
Mhm.
like me, probably not a good job for me,
Right.
because I would probably have a hard time shaking those experiences out of my body. It would stick with me. This is my whole history, and that's true of my clients. The ones that have chronic pain issues, they're sensitive people typically, not everybody, because you can still get traumatized if you're not a sensitive person. It's just that you're more likely to be overwhelmed, and that's what trauma is. It's an overwhelm that can't be processed at the moment. Um, so it's interesting. I mean, it's interesting to see these new paradigms showing up that kind of explain why people suffer so much and why it's so hard when you go to regular practitioners to get any help, because this view is still up and coming, and there's still this tendency to blame the client or the patient. Oh, you must not really want to be well because you won't think positive or something like that. So actually, I kind of went a little off the trail here, but what I'm wanting to explain is that whatever nervous system state your subconscious puts you in, and this is what happens, the subconscious decides how you're going to think, feel, and behave in response to its perception of your situation. And therefore, you're going to be, if you're in these deep states of shutdown or freeze, which is that's a nervous system response that's very ancient, you will be depressed, low energy, negative, and nihilistic typically. And you can't help it, right? So this, chronic pain and mental challenges are the same thing. So depression and chronic pain aren't any different. And this is, people think they're separate. They're not. Every single chronic
Yeah.
pain person has depression, right? Is every depressed person in chronic pain? No, not if it's not chronic and super deep. But anyone that's really seriously stuck in a deep depressive state, it's considered a form of chronic pain, right? So you've got this, psychological and physical issues are not separate, and this is part of the mistake we've made in the past, is seeing them as separate. So you can't, this, and again, I'm not saying that thinking positive never works, but in the deepest states of chronic issues like chronic pain, telling someone to try to think positive is really kind of like asking a person with a broken leg to run.
Yeah.
Not going to happen. Not till they get further up the ladder of regulation, and then it helps. So
Yeah.
anyway, that's kind of a long answer. I hope that helped.
No, it does. And it actually, I think I'll come back to this. And because we started with the NMT, the neuromuscular therapy, and we'll
Mm.
get back to that. But, in these recent years, as you've done this deep dive into neuroscience, you've developed like your polyvagal chart
Yep.
that's behind you here,
Yeah, it's behind me.
and,
Yeah.
and the course, right?
Yep.
The whole course that you created online with all of the recordings and the quiz it, like that's a huge piece of work that is clearly kind of where your trajectory,
Yeah.
seems to be headed at this point in your career. So yeah, so that's really amazing. And definitely, personally, I'm into it, right? This is
Yep.
very helpful for me, the course and all of that. And then this is something that I think is also just great to have this opportunity here to bring this information to my classmates, right? Who are
Absolutely.
in this holistic healing. A lot of them are brand new to the polyvagal theory. I keep bringing it in and having, my presentations and everything. It's very much, um, I think, just central to so much of all of this. So yeah, so that's amazing stuff, and we'll circle back to that shortly. Um, so how long, like when did you start your I guess, well, two parts, right? When did you sort of start your business, the Westgate
Mhm.
Therapy? And, when did you start your training and just that initial like, I want to be a body worker and do that?
Well, that is kind of an interesting journey I had in that regard. It's not very linear. So what happened is I've been in business for 22 years, but
Okay.
about 10 years before I even had any thought of being in this profession, because I didn't have any ambition to be in this profession. Well, I was wanting to be a fine artist. I had gone to, I started at CCAC. It was called then California College of Arts and Crafts. Now it's called CCA, California College of the Arts. I finished at the Academy of Art College. That included a year abroad in Florence, Italy. And I was like, oh, I want to be a fine arts painter. And it just didn't work out. There was a lot of reasons why. It had nothing to do with talent or ambition on my part. It was family problems, chaos, lack of time and money. I mean, it just was, the unperfect storm in turn. But there's an interesting thing. So what happened is my stepfather was a neuromuscular therapist,
Ah,
and we used to read the books that he had laying around, including the definitive guide, or kind of the first book on trigger point therapy. The main doctors, Simons and Travell. Yeah, Travell was the first female physician in the White House, and she was there with Kennedy.
mhm.
And she was a pain expert, and she pioneered trigger point therapy. And then Dr. Simons joined her kind of halfway through her journey, and he brought a lot to the table, and then they pioneered it together. Anyway, um, then my stepfather also would work on me, and he also studied Bowen method, which is from Australia, and
Mm,
is another sort of kind of a body system reprogramming technique that has to do with tendon stimulation.
mm,
And that's pretty cool stuff too. I mean, I haven't studied it myself, but what I'm doing in totality is pretty much the same idea overall. Especially with neuromuscular programming.
mhm.
Anyhow, then my stepmother, who I was close to, had chronic pain problems. And I had always been good with my hands in terms of body, massaging people's shoulders and all that stuff. And we were living together in San Francisco. It was beneficial to both of us. I was trying to get my art career together. She needed support, and I was grateful to her because she'd been really good to me. So I would work on her. The routine that we settled into is that I would work on her um, probably an hour to hour and a half a day.
Mm,
And she had taken the trigger point therapy training herself years ago. She had not become a body worker, but She knew it. St. John method, it's called in Florida. That's the training. That's the type of trigger point therapy. And she would coach me when I worked on her, uh, and give me tips. Also, she was a nutritionist,
Mm.
and a medical intuit, so she taught me how to do that stuff as I worked on her. And this went on for 5 years.
And was
So
this was in the, like, 90s, would you say?
yeah, it was in the 90s. And so I worked on her for an hour to hour and a half for 5 years straight, almost every single day.
Wow.
And about, I don't know, near the 4th year or so, maybe 3rd year, I forget, she said to me, "You know, you're better than people I pay, to work on me.
Mhm.
And why don't you go get certified?" And, at the time, I was working in restaurants, I was trying to figure out how to get my art career together. Okay, why not, right? And so, because I enjoyed the work, and so I took some, I got basic massage training, got licensed, and then started to work at a chiropractor's office part-time.
And was that training through is that when you went to San Francisco School of Massage?
That's right, yeah. And the thing that was so astonishing is how effective I was at helping people.
Mhm.
So there was this, I remember, I think it was the second year that I was part-time. It dawned on me, wait a minute. I'm good at this. I like the work. People are giving me fantastic feedback. Maybe I should do this. But it dawned on me kind of slowly because it was not my, how you have a frame of what you're shooting for, and this didn't fit the frame. But there was another aspect to it too that's really interesting, and I think this is pretty important for anyone that wants to have a body work career. I like being physical. I hate sitting. I always
Ah,
have, ever since I was a kid. It's like school, you sit and look at the stupid chalkboard with the fluorescent lights on and listen to the teacher drone on for who knows how long. And I'm like, oh God, shoot me now. So that was it's a big aspect of what I like. I also like that it's a social profession. So in other words, I get to
yeah.
meet people, talk to them, connect. I love that. So that was a kind of a aha moment. And the thing that's also very telling is that every single year that I've been in business, um, I have gotten better at what I do, and I usually, more and more successful. And
Yeah.
that's no small thing. I mean, you want that in your life. Is you want to feel like you're progressing towards a better you. You're helping people on the way. It's meaningful. That's what I discovered. And the other thing that's really telling too is how passionate I am about learning about it.
Mhm.
So, it's not like I'm like, oh God, I have to read about this profession. Instead I can't wait. And, I've had multiple study groups. That's actually the other thing I want to put forth here is I actually don't have that much official training because
Mm.
I've never really cared for that kind of training. I find it's exhausting. I mean, you go to like a 4-day workshop, and by the second day, your brain is so overloaded that you're kind
Mhm.
of like blurring your way through the whole thing every day, and you're like, ugh. I don't like learning like that. What I
Yeah.
like to do is take information gradually, try to integrate it in real life, my practice, and get feedback from clients about whether it's worth even pursuing. Because when you try it on yourself or others, you have a feedback loop that shows you relevance. And in other words, does this help or not? Is this worth learning or not? And I find that a much richer way to learn. And I'm dyslexic, and apparently that's a very common dyslexic preference.
Mm.
One of the study groups that I helped, I actually didn't teach it. I just facilitated it, and I didn't create the space. And 12 years, 3 hours a month of intense study with colleagues. Some
Mm.
really brilliant ones too. And that's the other thing I want to say is that you want to get better, study with people that are way better than you. It's
Yeah.
it's absolutely the best way to go. And that's what happened. I was completely overwhelmed and intimidated for the first 5 years.
Yeah.
And then I started to get my feet under me and noticed this huge improvement in how I was affecting my clients' outcomes and my ability to kind of um, I wouldn't figure out is not exactly the right word, but kind of intuit your way through a session rather than trying to be too mental about it.
Mhm.
And that's what comes with tremendous amount of practice, right? You get this flow state and you're not figuring out at all. You're just following the sense of it. Like, okay, what
Yeah.
do I do next? Okay, I think I'm gonna go over here. Oh, and then you look at the feedback and yes, that seems good. And then they come back the next week and they're like, oh my God, I'm so much better. Okay, that worked. It's like, because there's the
Yeah.
feedback loop, right? I think I did good. But then when they
Yeah.
come back and they're raving, you're like, well, okay, well, that's obviously that flow worked. And so therefore you learn from that.
Well,
Uh,
that's, it speaks to like your art background and the creativity
absolutely.
of you. And I think it's really interesting that you talked about, a 12-year long study group, you know,
Absolutely.
learning from other people. I as you're talking about these workshops, I have an interest in cranial sacral, and I've gone and taken a couple of intro courses at McKinnon Bodywork out in Oakland, but they have, like a 24-hour intro thing, which is 3 days, and then they have 125 hours, which you come back and you'll do several months
Right.
of and 1 day a week. And so, it's a course, but it is a gradual, longer term thing. And, when I was working at the spa, one of my colleagues was like, oh, like, I'm really interested in cranial sacral. I'm like, oh, cool. Like, where are you planning to go and study? Like, what have you learned? And she's like, oh, there's this 4-day thing in Vegas, and I'm gonna sign up and go to Vegas. And I'm like, okay, cool. And then like start, okay, cool. Like, tell me what you learned. So she comes back and she's like, yep, I'm ready to go and start my practice. And I'm like,
Oh boy.
but like, do you know about biodynamics of craniosacral? Like, have you talked about like, and it wasn't, it was like this whole whirlwind thing. And cranial sacral, like, I don't want to go into a tangent on that. It's a whole different conversation, but it is detailed, and
Absolutely.
it is like, it is a very intuitive, slow thing, and you don't want to rush it.
No.
And so it's interesting that, yeah, we see these magazines with like, learn cupping, myofascial, get your certificate in like 25 hours.
Exactly. No, well, it's this is a good. I'm glad you're bringing this up because I am a absolute true believer in the idea of kind of the old school idea about learning your craft with pride and really real intention, right? And to do that takes tremendous dedication. So, like I remember, here's a good example. I have a colleague, Bob Gazo, which I think that you took a course with him at one point in anatomy, right? So we were in that study group together, and we had a colleague that was younger and just starting out, and he says to us, "How do I learn how to palpate as well as you guys do?" So palpation, obviously, that's how you can tell what's going on in the body, right? And it's one of the things that one of my main mentors, Thomas Wells, who was the leader of the study group, he said, palpation is the absolute most important thing you have to be good at body work. Because what it does is it's your scan, it's your MRI. And what you do is you touch and you know what's happening. And then you treat and then touch again and know if it worked or not. I mean, besides the report from the client, the tonus, the texture, right? All this but how do you do that? Well, you have to do a lot of touching. And
Mhm.
so what Thomas and Bob told this guy is like, here, what you need to do is get your hands on as many people as possible.
Mhm.
So they said, go work somewhere where it's high volume. Don't worry about the money. Just work on lots of bodies, and maybe 2 or 3 years of that.
Mhm.
And that's the reality right there. I mean, like I remember one of my colleagues who's a Pilates teacher down in Redwood City, and he teaches for Balanced Body. Tom Cook. He said to me, in his opinion, once you learn Pilates, in school, you should teach only the basics for at least a solid year before you do anything else with your clients. Because he says you don't know the basics till you do them over and over and explain it and show it and explain it and show it for at least a year minimum before you think you know how to go beyond that, right? And I totally agree with that.
Yeah.
Um, fundamentals is never too many times to review fundamentals. Like
Yeah.
and this is the thing is that if you want to be, it's like an old school craftsman. It's your job. It's not something you're doing till you be an actor, right? This is I take my profession very seriously because when someone shows up, they need me to be grounded, knowledgeable. They have a problem. They have a life to live. They have people to take care of. They don't need me to be bumbling around, coming up in late, hungover. No, wrong. I mean, this is, I take it seriously because when I do show up and I help someone, it feels incredible.
Mm.
I feel like I'm actually fulfilling a purpose that's really important. This is not trivial. It's like I'm actually really grateful. I remember, see, how long was I in business then? Let me think about this. 7 years, maybe 5 to 7. I forget. Anyway, no, it must have been about 7 years or a little bit more, 7 or 8. I was recently divorced and I was dating, online dating, first time I did it. And one of the first people I talked to, this woman, we talked on the phone for the first time. I think we were on eHarmony. And she says, "Well, why don't you tell me about yourself? And what do you do for work?" And I said, "Well, I have this neuromuscular practice. I help people with pain. I love what I do. I look for it. Most days, I can't wait to go to work." And there was a silence on the phone. And I was like, "Are you still there? Did we get disconnected?" And she goes, "Oh, no, no." She goes, "I'm really sorry. I'm just so jealous." Right, because one of the things that I've discovered over the years is not very many people feel the way they do about their job that I
Yeah.
do.
Yeah.
And I'm very, very grateful for that because we all spend a lot of time working. So do you really want to do a job that you don't really care about? I don't.
That makes you upset and you're like, oh, I have to go to work today.
Yeah, right. Oh God, and then, you don't see any proof of your effectiveness in helping the world be better, right? And maybe you do, but you don't know. I mean, if you're in some cubicle pounding away at the keyboard and never seen any feedback loop that says, "Thank you so much for what you did. My life's better." That's not for me. So I kind of
Yeah.
feel like I ended up where I belong, especially given my success over the years.
Yeah. So tell me, because you and I can talk about these things for like
28.
hours. I'm like, so many books. Like I could write like a whole book. I'm like,
Absolutely.
so tell me about your business setup then.
Oh,
So
sure.
where I know, I go to see you on Nellen Avenue, and you're in
Mm.
a bigger office with a lovely view of Mount Tam, and you were in the smaller office. But so tell me about that, like how that practice, how you ended up in Nellen, and your website, and kind of how you are as Michael Westgate Pain Therapy.
Mm.
Hello, what is your tagline?
Hello,
Goodbye.
goodbye pain, hello life. Yeah.
Yeah. Yeah.
I'm really glad you're asking this. Because this is kind of a passion. I'm really passionate about this subject. Unfortunately, healers, including doctors, are some of the worst business people on the planet. And part of the reason is because often the creative spark, which is very akin to the healing spark, because it's kind of interesting. I've read some books about surgeons, and apparently surgeons, they're very creative. No surgeon does their surgery the same way as the other. It's just really funny. At any
Art.
rate,
Yeah, they think about it as sort of an art,
they
right?
do. It's very creative how they approach it, which I thought was fascinating. Any rate, so there's this allergy in healers, especially body workers, to business. And it's a disservice to your clients. And this is something I've tried to teach when I was teaching trigger point therapy at Alive and Well in Marin, because I taught there for about 3 years. I would offer, I mean, I got to tell this story because it's so incredible to me that this is the case. Every class I taught, at near the end, I would say, I have been very successful at setting up my business systems and helping me have a decent income while helping a lot more people. If any of you want to know how I do that, I would be glad to meet you at my office for free and tell you how I do it. So 3 years of teaching, I think I probably had somewhere around 300 or 400 students. How many do you think took me up on that offer?
I mean, one or
One. Yes, one. Not even 1%. I mean, this is insane. And I don't even know what went through the heads of these other people, but I'm guessing that there's some sort of judgment.
you
Like,
think?
marketing's wrong. It's manipulative. I don't care about the money, that kind of stuff. And it's like, you have to care about the money because you have to live. And if you don't live properly, you can't be showing up as a healer the way that you could if you are, right? So, you have to take care of yourself. And the Bay Area is really expensive too. So if you want to do a business here, it's not a charity organization, right? It's a business.
Yeah.
And you don't have to be embarrassed about that. There's no apology necessary, right? I mean, you need to live and you're providing a valuable service. And that's part of what I had to break through myself is there's this, I don't know how much this is true now, but when I started, there was this very strong cultural perception as massage therapists or body workers as kind of the bottom of the hierarchy barrel of healers. And what I've noticed over the years is body workers tend to embody that and live it, almost as if they don't realize that that they have a choice otherwise. Right. So you're saying, well, I'm just a massage therapist, and the
Yeah.
chiropractor is the doctor, and fine. I mean, you respect the doctor, fine, but you are not lesser. And the thing that
Yeah.
really struck me early on was when I worked in that chiropractor's office, is it was the patients telling me, multiple patients, that they got better because of me, not the doctor. I heard that
Mhm.
over and over again. I mean, these people are saying, I've been coming here for 6 months. You showed up and I'm better in 3 weeks. That's when I started to realize that there was something wrong with how we were perceived. Right.
Mhm.
So, anyway, so the reason I'm bringing that up is that whole mentality leads to this sort of lesser than attitude and this sort of, okay, I'll just work in that little dark room in the corner that no one else would possibly use because it's not even ventilated, and get a small cut of the income, and then you're supposed to kind of bow down to the hierarchically higher valued doctor, and consider yourself lesser than. And what that translates that often into is not being good at business, because when you show up at being as good at business, you actually foster respect immediately, right? What happened is I was lucky enough to have an inherent sense of marketing and business. I don't know why, I just
Mm.
do. But I also found business coaches. And my
Wow.
first business coach told me to read this book called The E Myth, which is I highly recommend reading. It's an E myth. What that means is the entrepreneurial myth. And
Mm.
what the guy explains in the book is that to have a successful business, you have to set up systems that guarantee that people have a certain experience every time they show up. And those systems include scheduling, the room, like
Huh?
how it's set up, how clean is the linens, decoration, water. I mean, all these things that would be helpful. And even the way you greet someone, follow up,
Mm.
taking payment, so on, right? And by the way, these are not easy things to figure out. So that's the other thing about the E myth is business is not intuitive. That's especially entrepreneurship is not intuitive. You must learn these things by study and application, and it's not going to happen overnight. But when you do it, it just is incredibly helpful for your business. And so I studied the E myth, and I worked with my first coach, um, and it made a huge difference because we did my first branding, which, by the way, I don't think that a branding project is the first thing you should do, but eventually it's really helpful because what your brand does is it makes you attractive to the sort of people you want to have come to you, right?
Mm,
So that's what the brand is. It's like a sign that says burgers, like, McDonald's. So you know that if you want burgers, that's where you go, right? But so what I did with my brand is I put up an image that said chronic pain, sports injuries. That's what you come here, you get better. That's basically, and I'm professional. I brand myself as high end, so I charge more than the average person. I work in a nice office, and
mm.
I worked my way up to having a view of Mount Tam, which is wonderful. But I didn't have that overnight. I mean, I paid my dues. The other room I was in wasn't awful, but it was pretty small and it was cheaper, right? And so, um, yeah, those bookkeeping, you don't necessarily have to do it yourself, but you have to understand it.
Mhm.
Scheduling, it's really, I have a system that's online, so people can schedule online. They can call a service that will deal with things that 24/7. And
Mhm.
then it sends reminders. It sends birthday, happy birthday, $30 off, come back in.
And
Uh,
that's all automatic.
that's all automatic. Yeah. So, and that's actually that's the part what you want is for these business systems to be as automatic as possible so that you don't have to be burdened by them. Like one of the things I absolutely hated, I mean, it was like, torture, was having to schedule and call people back on, either email or on the phone. Oh my God, what a waste of time. And
Tedious,
oh,
yeah.
just exhausting. Because what happens is someone calls you and says, "Do you have anything on Wednesday?" Oh, you have 2 slots. Then you get back to them, "Yes." But then they take 48 hours to get back to you, so they're gone. So then you have to start again and say, "Well, what about" oh god, I mean, oh boy, so, um, setting up systems is really helpful for everybody, right? And that's what business is. Doing good business is learning systems, and that includes systems of marketing. So I learned how to network market.
Mm,
Now I'm working on internet marketing. And the reason I'm doing that is because I want to have a bigger reach and I want people to find eventually find my course. And
yeah.
I have a bigger scope of helping people. And also I'm aging, right? So I'm 57. Um, I take very good care of myself, but I know that I can't work at the volume I'm working forever.
Yeah.
So what's the second, what's the end game? Well, the end game is to morph my profession with my skills and my knowledge towards a at least less physical form of it, right? And over time, and I've also found tools that help leverage my physical abilities more, and I'm looking for more of them. Actually, I'm looking for different things I can use that were equally as effective as when I was being 100% manual, maybe even more. And so that I can, because by the way, I don't want to stop working.
Yeah.
I don't have this, oh, I can't wait to retire thing. I don't want to
No,
retire.
you have a lot of stuff to give,
Yeah,
yeah.
I mean, and I feel like I'm finally getting my stride. I mean, I'm hitting my stride finally, and I'm like, why would I stop when I'm
Yeah,
actually getting good now? And I have all this wisdom, and
yeah,
I'd actually, I'm hoping I can work into my 80s if possible. That would be
yeah,
my goal. And the other thing is the purpose and meaning behind my work is going to help me live longer anyway.
yeah,
Because again, there's a reason to get up. You're like, I'm going to get up and make the world better today. Huh,
yeah,
that's pretty cool.
yeah.
Um,
Well,
and
it's
you know,
evolving, right?
yeah,
And bringing your courses, making the Polyvagal course online and
yep,
having contacts and people through that. Yeah, you're still helping, you're still, you know, sharing your knowledge and your experience, and your body is a little bit safer
yeah.
because you're not, moving around so much. When you talk about your volume, So what is your volume right now? Like how many clients would you like how many clients do you have and then that you see during the day and like
So
what?
that's a really good question. And this, by the way, this took me years to figure out,
Mhm.
like the ideal rhythm of and volume levels, right? So I have 3 days a week where I see up to 7 people a day, and it's 50-minute sessions. And then 1 day a week where it's 6 people max. So
Okay.
that's and what it is I work Tuesday, Wednesday, and then Thursday's admin. And then I do Friday, Saturday, and then I have 2 days off.
Okay.
And this is really, really critical because when I started, like all of us, I was clueless about how to run a business, but I was learning. And I remember there were days I'd work on 9 people without a lunch break. Of course, by the ninth person, I felt like I was going to keel over and I had a headache. And it was just stupid. And I was like, I remember this was probably my second or third year in business. I was like, maybe I should actually block out my lunch hour. And that wasn't obvious. Well, it wasn't. I was, I was dumb, and I was also desperate for work, and
Well, and you want to help people. So if
mhm.
people want your help
You just
and
want
you
to say yes to
have
everything,
an hour, like, yeah, you're like, well, shoot, I was gonna go get my lunch, but it's okay. Like, you need help, so come on in.
That's right, exactly. Yo, you want to come in at 7 at night? Yeah, okay. It's like no, no, you have to. So what I did is over time, I've created a structure. I basically work 9 to 5. Basically, I mean, I'm saying it's a little different some days, but not much. I have my lunch is either at noon or 1, depending on the day. Um, I I have 2 days a week where my lunch hour is an hour and a half because sometimes I need time to work on something or and I actually take naps almost every lunch. That's the other thing.
Oh,
Um, and the other thing I wanted to bring up in terms of workflow is that this hasn't been my whole career at all, but in the last, I would say 7 years or so, I have dedicated serious time to self-care every single day.
mhm, mhm.
And that has transformed my experience of working because my body used to hurt a lot. Now, part of that was my own trauma history, and that's a whole nother story, and dysregulation. But the other part was there was no cross training to the kind of those awkward positions that you're in all day. And it's repetitive too. It's repetitive stress, and you're leaning over. So I would say a minimum of a half hour of self-care a day, but it's usually more like an hour and a half to 2 hours in the morning.
And
So
what does that include? Yeah.
so that includes potentially meditation, breath work, different kinds of exercise, whether it's yoga, high intensity interval training, stretching. I mean, it just depends on whatever I feel like I need. And
Yeah.
one of the reasons why this is so critical, by the way, is I'm going to go back to polyvagal theory. So, one thing that Dr. Porges, who's the author of polyvagal theory, said in one of the trainings I did and this absolutely blew my mind when he said this. He said, he goes, it's my belief, given what the theory has shown at me, that how you are in your nervous system and how you relate to your client or patient is up to 50% why they get better.
Mm,
Because what you do is when you're centered and calm, there's this co-regulation that happens between you and the client that can draw them into that place with you. Where if you're not, you could actually make them worse by drawing them into that negative, kind of that dysregulated place. And when I finally got that straight in my head, because it took me 3 years to fully understand polyvagal, and I spent hundreds of hours studying it. And the reason I did the wall chart that you see is because I was having trouble keeping it straight. So I started to make these charts with paper because I'm an artist. And then I eventually went into the electronic world with the help of a graphic designer. And now the design is 100% mine, but she helped put it into electronic form.
mhm.
Um, and once I really grasped that and what then Porges said in the class, I realized that it was immoral for me to show up to work dysregulated
Mhm,
because
mhm.
I'm ripping off someone when they come in and I'm not centered. That's what they're paying for, right?
Yeah.
And that was really a big moment for me. I was like, And by the way, I don't think it'd be any different if you're going to a bank job.
No, yeah,
Right. I mean, it's you need to show up your best self as best you can muster. Otherwise, you're ripping people off. And that meant my body too. I can't go, be a healer with chronic pain. And I was actually for years. And
so many people are, by the way.
but
So cool.
yeah, exactly. I mean, the wounded healer, right? I mean, I'm totally that model. I mean, it's just kind of funny when I look at it and like, how did I end up doing this? Well, it's not that mysterious. I mean, I came from a situation where I really wished I could heal my parents because they were so dysfunctional and traumatized and unavailable and so on. So, but what a great way to channel it. I mean, because it's like it's appropriate way to channel that,
Yeah.
and it's helped me personally to be that person. So, I'm not complaining. It's
The
but
polyvagal stuff is it is really, it's important, and it is very much like paradigm shifting for our entire,
oh
you
yeah,
know, culture, but also like the world.
absolutely.
I'm
I
studying a lot of sustainable health and ecological resilience and stuff, and the trauma, talking about activism
yeah.
and healing the planet,
Hmm.
that freaking dysregulation stuff, the poly, like it's it's everything. It's like it's
Yep.
cracked open, the evolution of what it means to be human and what it means to have consciousness. Like, you know,
It really is. It's one of the things that Deb Dana said. So she's one of the experts on how to apply polyvagal, at least in psychotherapy. She said at one point in one of her books, she said, once you learn polyvagal theory, you'll never see humanity, yourself, and the world the same again.
it's
And
true.
and the thing that's so powerful about this is that it's an incredible tool for forgiveness. Because what polyvagal teaches us is that most of our behaviors and reactions are subconscious, and we're talking about somewhere around 97%.
Yeah.
So, and that's on a daily basis. So this illusion of self-control and self kind of deciding how we are is absolute fantasy. Um, although I'll do it. The caveat to that is once you learn polyvagal theory, like I teach in my course, you can alter that. And but basic the part of what I discovered is that it's not so much that you learn how to mentally manipulate it. What you learn how to do is reprogram it so that it responds in a way that's more helpful to you and the rest of the world, but you're still not really in control. What you're doing is you're oriented internally differently so that you are more adaptive in your responses, more helpful in your responses, but it's still subconscious.
Yeah.
And it's, as Porges says, spontaneous. It's a spontaneous response because your whole biology has shifted to a different goal. And if
Yeah.
you're if that goal is you're socially safe, you feel centered and grounded, then you draw others towards that. But
Yeah.
when you're threatened and you feel like you're being attacked, even if you aren't, then what you do is you tend to draw people into that
Yeah.
scenario, right? So and that's why it's so important to be centered.
Yeah.
And having that automatic system in a more adaptive place overall. And that's
Yeah.
my experience. So yeah,
Yeah.
and it's also, when I look at world events, and I don't want to really go deep into that because it's a lot of upsetting stuff happening. Through the polyvagal lens, it's so much easier to understand why this stuff is happening
Yeah.
and what the potential cures could be. And it's not what most people talk about. It's really about, how can you help everyone feel safe in their own body and environment? If you can figure that out, everything else changes automatically. So it's kind of like this, if you have a group of people that are, afraid for their safety, on both sides, actually, in this case, in the Middle East,
Mm.
um, nothing's going to change until you help each side feel safe. Because the automatic reptilian brain, the reptilian brain kicks in, and there's no logic. There's not even compassion. It just kicks into I have to survive, and it's true of us individually too. So one of the things I learned from my studies of polyvagal theory and other stuff that Basil van der Kirk talks about is that when you are in a trauma reaction, you have no control over your actions, and at least temporarily, and you will do things you really regret, and you can't believe that you did that. Well, that's
Yeah,
because you weren't in control. That was your nervous system taking over, and that's why it's so important to optimize that, and that's why I'm so passionate about the subject, because it's like you can't will yourself through your life. You have to tune yourself to be adaptable and hopefully optimized in the case that you actually draw people towards a more safe, civilized, higher brain state. And
yeah,
then everyone's better off. You don't have to control yourself. You're automatically better. So anyway, but I could
yeah.
go on for hours.
I know. Yeah, I know it's really interesting. I sent you a link to this dystonia recovery program that I found. And my experience now of like understanding, learning about dystonia and learning
Mhm.
about, yes, it's got physical stuff, but it is in my brain.
Yeah, it
Like
is.
my anxiety and all of that is the dystonia. It's like my thoughts are spasming, right?
That's right.
I wind up having like, these regrets. It's almost like I'm inside here and I think about something and I do it and I'm watching myself do it. I'm like, what are you doing? You're breaking this thing,
Yeah.
And then it's like, why did I do that? And so learning all these things together, and this polyvagal is like, it's it's fascinating, and it's incredibly helpful, and it's really hard,
Yeah,
you
it's
know?
not easy. I mean,
Plasticity, it's like,
I mean, kind of what I said before, even about, how do you learn how to palpate? Well, you have to practice like crazy for years, and it's
yeah,
not easy. This is no different.
yeah,
And one of the things that Porges said in his recent book, Polyvagal Safety, is that he has a whole chapter on long COVID, and he says that in his opinion, long COVID, a large percentage of long COVID is PTSD,
yeah,
and the reason is because there's the media scared the shit out of everyone. I'm not gonna have a judgment about that, but that's the truth. Um, Early on in COVID, when you got sick, you were isolated socially. You were treated like you had leprosy, basically. And then anyone that contacts you is in a frickin' spacesuit, like an alien, and or maybe you're hooked up to a ventilator, or even if you're not, you can't breathe, which makes you afraid you're going to suffocate.
oh,
Um,
yeah,
so the virus itself isn't the totality of the problem. It's the nervous system interpretation of kind of imminent death and overwhelm and
yeah,
loneliness and isolation, right? So when I read that chapter, I was like, God, this makes so much sense. So it's the messaging, the actual virus, which was overwhelming, and then the experience of being socially isolated and being cut off from your loved ones and cut off from touch and reassurance.
oh, yeah,
Yeah, that do you in no matter
yeah,
what. It's like, so that then you get
yeah,
stuck in a chronic state of feeling unsafe, and then your health just goes boosh down the tubes. So yeah,
yeah,
that's
yeah, and and as we're going past COVID into, this post-COVID world, and seeing how, like, this Zoom space thing that has now evolved and the entire world is on Zoom.
yep.
My classes in integrative health are on Zoom. You know,
Mhm.
there's like this conscious separation now of physical connectedness.
Yeah, there is.
And that, and some of us, I recognize it, and so I complain about it, and I still try to go and see people in person, and but a lot of people, like, if I'm like, God, but don't you remember when we used to have class like in person? And people are like, we did that? Like, what do you mean?
Yeah.
I'm doing wellness coaching through our through the school, and pre-COVID, the school, they had some hybrid classes, like they have monitors and cameras in there, but it was like a bustling building.
Yeah.
And so when I started this health coaching thing, we had a meeting on Zoom, me and a couple of my classmates and the director of the wellness center. And I'm like, so okay, when we get our clients, I know we can do Zoom, but is there a place on campus? Do you guys have like little rooms or something that we can go
Mhm.
to and meet our clients in person the way we used to do? And it was like crickets on Zoom space. And I'm like, they're like,
Wow.
oh, I guess maybe, I don't really know how to do that. And I'm like, wait. So didn't you have people coming in before?
Previously, right? I mean, like before, before the dark ages, I'm back in the dark ages, like
Yeah.
2 years ago or,
And I
4 years
tell
ago.
you, the pushback on that was like, it was basically like, I'm like, okay, well, never mind. I guess we're doing everything on Zoom. Like, but it was,
Wow.
baffling to me.
It's
Um,
it's a real disconnect, and I
yeah,
think it's terrible, and I'm
it is. And I think Harvard, one of my health coach mentors, she actually forwarded me an article or a link to an article that it was Harvard or Yale or one of these big schools have now officially done a study showing the decline of receptivity and
Mhm,
knowledge,
mhm.
and from people not being in classes. And it's because of stuff that we talk about here with micro movements of the eyes, the breath, the mouth,
Yep.
things like that. That I know when we went on Zoom, immediately my animal body was like, "This isn't right.
Mhm.
Not right. This is giving me more anxiety because I can't tell if you people like me or not. Like I can't
That's
tell if
exactly.
you like, are you bored on the other side of that camera?
Yeah.
I have no idea, and my animal body is like, that is a huge part, I think, of a lot of my anxiety and extra headaches and stuff that I'm
Totally.
getting is because of all of this, like, and it's computer time. I'm like, today I finally put my little orange glasses on
Mhm.
because I am having migraines like majorly. And I'm like, yesterday I was on the computer for hours. Today I've got more hours. I actually had to cancel a session. I was supposed to have one at 5. And I'm like, you know what? I can't because by the time I have this and then I have to get off soon. And then I have another imagery session and then I have class from 2 to
Oof.
4.
That's a lot of screen time. I
Oh
mean,
man.
there's all kinds of aspects of it too, because your orientation system is like if you're in a real classroom, you're not just looking at a teacher, you're looking around, right? You're making eye contact. People respond to something that happened up front, and you might laugh and look at each other. I mean, it's a whole different universe, and it's way better for your nervous system to be in a social group,
Yeah.
generally speaking, because we share nervous system regulation. That's one thing that Polyvagal teaches us. We're co-regulators, not self-regulators, not at
Yeah.
least not initially. And basically, what Porges says is you are only as regulated as everyone you know,
Yeah. Yeah.
or everyone you come in contact with on a daily basis. So if you are in a group and the group is doing well, everyone does better, because your nervous system kind of records and maps. Oh, lots of allies, right? Lots of tribal members that I'm in good sync with. I'm better now. And it relaxes more and gets kind of deeper. So it's very healing to be in groups, well, not if the group is negative, but even
Yeah.
that, like even having a contentious environment that's but not violent, still can kind of it stimulates the system the way it's meant to work. And when we're all isolated, hiding in our little caves with these little portals, it's like it's not what we're built for.
Yeah. Yeah.
No, it's very, very challenging. Okay, so we're about time, right?
Yeah, just about. And this has been awesome. Like I knew it would be. So thank you.
You're welcome.
I'm so grateful that you and I have this relationship, and I've known you for so many years. You already know. You are one of my mentors. Like this is so thank you for this. You've answered a lot of questions that I didn't even ask that are on my list.
Oh,
But
great.
yeah, oh no, totally. Like it's been very organic and awesome. So my last question, well, we'll do two so that we don't end on a negative note.
Oh, there you go.
The first one is, what are your least favorite parts of the work that you're doing right now? I know you love so much of it, and as we've said, it's evolved to be the thing that you love. You followed the good things that you like and created this thing. So, what are your least favorite parts for the work? And then from that, like, what are your hopes for your discipline, and kind of healthcare in general? And this will be going, I was about to say less on polyvagal and more on neuromuscular, but not really, because as we've been talking about, it is all blending together. So yeah, so your least favorite parts of what you're doing now, and kind of your hopes for the next generation or the next moves for you.
That's a good question. So least favorite parts have mostly to do with paperwork oriented stuff. And I don't take insurance directly. I do super bills for people. I hate doing that stuff,
Mhm.
especially because the insurance companies purposefully make it hard to know how to do it right.
Mhm.
So it's, and I don't really want to stay on top of all that because it's just it's a stupid game that is based on nothing but profit motive and I really hate that. I have successfully delegated like my bookkeeping to someone else mostly, but I still have things I have to do myself. I tend to avoid them. I tend to have to set aside time every 6 months to kind of blast through it because it's built
Mhm.
up. That's part mainly my personality. I mean, I'm not a paperwork kind of guy, but that's probably the worst part. I mean, the only other part that's a little tough is that if I get hurt, you
Mhm.
know, or I'm getting, kind of feeling sick or just fatigued, it can be pretty rough going to work. Um, I have a high pain tolerance, and I'm a very disciplined person, but there's stretches where I'm like, God, this is rough, because you can't coast really, right? And that's hard. Um, I think those would be the most, yeah, those are the hardest parts for me.
Yeah, and I
Um,
I
yeah.
before I let you answer that last question, I just wanted to also just note that a few weeks ago when you sent out an email having to reschedule the polyvagal class because you were sick,
Hmm.
it's like, okay, like he must
Yeah.
not be feeling good, because even in the description that you just talked about right now about getting injured, you didn't say like, oh, when I have to cancel on people. You're like, oh, well, I still,
I
I
usually work no matter what. And
yeah.
I'm pretty good at working around. I hurt my left shoulder a couple years ago, and luckily it wasn't a horrible injury, but it was fairly bad for a while. And yeah, I was in pain most of the time, and when I was working.
Yeah.
And but I've treated it properly, and it got better, and it's now 100% better. But it was like that was rough, and of course, I chastised myself for being such an idiot. The way I injured myself was stupid, and I was like, you can't afford that, Michael. And so, I mean, that's the other thing is that one more thing that's a little hard about my job is to be responsible to my own wellness. I cannot do many things. I can't skydive. I can't do whitewater rafting at level 3. I can't do anything that would possibly give me whiplash or hurt my body, because if I do, I am screwed. Because this is my income, right? This is my whole way of making money. And so I figured that out years ago when I first started. I was like, I can't just do anything.
Yeah.
I can't just do whatever I want. I have to be very, very careful about my
Yeah.
body. And I'll probably thank myself when I'm 85,
Yeah.
because, I won't have all these broken parts and all this stuff. But there are days when I'm like, God, this sucks. I can't just do that thing I want to do. But
Yeah.
so
Yeah.
that's partly. And then, so the second question, so where am I kind of hoping to go, right? Is that what you're,
Yeah, like,
yeah.
what are your hopes, like, for your discipline? So for
Oh,
neuro
yeah. Well, I
anyone.
mean, from the time I started this profession, I really would love to see body work elevated to where it belongs.
Yeah.
Because those colleagues my colleagues that are really good, and myself, we help people in a very substantial way that often no one else can.
Yeah.
And I really hope that that as time goes by, there will be a shift in the level of respect for high level body workers as being on par with even certain doctors. Because I had someone come in recently that had some sort of problem with his ankle and foot, and he had a diagnosis and a prescription for PT. Now I'm not a PT, so he came to me because he couldn't get into the PTs. And first session, I it was like 80% better. And I have to say that the diagnosis was incorrect.
Mhm.
And this is an MD, and I'm like, well, he didn't get it's not correct. But I can understand why he put it there. It was tendinopathy or something like that. It's not true. It was tight
Mhm.
muscles. It was adhesions, all these things that they are blind to. I'm not
Yeah.
saying that those doctors are stupid or that they should be,
Yeah.
anything. It's just there's a blind spot there. And if they could just recognize that I have that vision, I don't pretend to know what they do, right? I'm
Yeah.
not saying don't go to your orthopedist, come to me. I don't say that. But why don't you back up and realize that there's a reason why people go to certain really great body workers and just can't believe how fast they get better. And the reason they get better so quickly is because we have a view of the body and the nervous system and healing that other people can't see because they haven't been taught it. And it's not a criticism; it's just the reality. So that's what I would hope is to bring that to. I've always had this idea. I want to elevate the profession up. I want it to go from the
Yeah.
stepchild of healthcare to on par with PTs. And
Mm.
as long as you do your due diligence, you truly learn your craft. There's no reason why you shouldn't
Yeah.
garner the same level of respect. That's what I think.
Yeah. That's
So
awesome. I love that. And that's, the purpose of, the class that I'm taking, and really the purpose of, this degree that I'm doing in integrative health
yeah,
is is that, it's bringing, CAM, right? Complementary and alternative methods of healing
mhm,
alongside, the allopathic doctors for
exactly,
the, pinpointed things. But the body, what we do as body workers is tapping into the body's own innate capacity for self-healing, you know?
exactly. And but the other thing that I would insert is that I completely disagree with the medical model of not becoming involved with your clients. And I don't mean sexually, by the way, of course. I'm talking
Mhm.
about a relationship. So I have relationships with each of my clients. Some of them have been with me for the whole time I've been in business. So I have
Mhm.
two clients that have been with me for 22 years. And I know, and they know that our relationship is meaningful. And it's appropriate. I mean, I'm not, I keep boundaries, but we care about each other. We're glad we know each other for this long. One of my
Mhm.
clients, he's 90 years old, and he's not going to last much longer. But I've known him for 22 years. I'm really grateful that I've met this man. He's a great person. He's done a lot of great things in his life. He's shared a great, amazing amount of wisdom with me about his life and just his experiences. And I'm like, I'm touched. And I'm grateful that he values me so much that he's been coming to me that long. I mean, it's something to be said about that, right? So, yeah, I don't, appropriate relationships with clients, I am going to assert is actually good for their and your health. And I do mean appropriate, but it's, again, it's polyvagal again.
Yeah.
If
Yeah.
they know that I truly care, it helps them heal better. And I do. So that's, I'm not ashamed of that, and I'm not going to try to hide it and say I have to remain detached. Come on.
No. And
So anyway,
yeah, and I've been with you since like 2017.
yeah,
So
exactly.
that's already been what, 7, 8, 9 to 20, what, like 6 years or something.
Hmm.
And yeah, and we have a professional relationship, right? I get your emails, the polyvagal class,
Yep.
the cancellation policies, all the things. You always stick to that aspect of things. And when I go and see you, yes, I go and see you because I'm in pain, but you're also kind of like my friend slash therapist on like a
Yeah.
nerve level.
And we
You
share this passion for this subject as well, which is it's better. You bring things to the table too, especially now that you're learning so much. And I love that because I don't know everything.
yeah,
You bring, oh, I have this article, great. Well, I heard this thing, then I know I never heard of that. What is that? This is that's kind of the culture of learning and uplifting each other. That's what co-regulation is all about, by the way.
yeah,
Is mutual benefit. Win-win relationships are polyvagal. That's ventral vagal. That's safe social safety is
yeah,
win-win. And that's the goal. You want to be win-win relationships with as many people as you possibly can. That's what's going to change the world, by the
yeah,
way.
yeah.
You know,
And
that,
I, you know, love the transition that you're evolving into with this polyvagal practice. It's huge. I love too that you are in contact with Deb Dana. You have
mhm.
talked to Stephen Porges. Like, you know, this is a big deal. And I'm grateful that have known you. Like, I remember when you were starting to draw the chart. Like, I remember
Yeah, because I was talking about it to everybody.
exactly, but it's look at where it is now,
Yeah, it's true. It's
you
evolved.
you have that box, the green, red box,
Hmm.
got
That's
to
a
check.
physio cam. That's Dr. Porges' stress monitor, or I should say, nervous system state monitor. And I'm actually working with Deb Dana and Benjamin Fry and a number of other practitioners to field test that. So that's,
Yeah,
I'm on the forefront of that, which is
that's awesome.
total
Yeah,
tingles. And I'll tell you, I never thought I'd be in this position, but I'm really grateful.
yeah, it's
So
your future is bright, Michael.
thank
Um,
you.
yeah, so thank you for this. I got to jump off so I can rest before my guided imagery session at 11 o'clock with my classmate.
Sounds good.
It'll be awesome. So good.
Great. Have a great rest of your day. Thank you for
You.
asking me to. Really glad to help you out and share my story.
Yeah. Thank you.
Right. Talk to you soon.
Okay. Bye.
If you found this content helpful, please like and subscribe. You can look forward to more videos about how to overcome chronic illness and chronic pain.